Dr. McChord, you want to go ahead and introduce yourself to us?
Hey, good morning, Dr. Brewer, and good morning to all the PrevMed tribe. Thank you for having me join the program today. It's been an honor to make your acquaintance and to collaborate on not only rehabilitating my own health, but working in this world of educating people on cardiovascular risk and prevention. Just about 2 years ago, last week marks the 2-year anniversary since I survived a heart attack. And that came as quite a surprise because at the time I did not exhibit any of the typical characteristics of someone you would expect to have an MI. My weight was appropriate. I had already made some positive changes in my life, recovering from some years of extraordinary stress. The red flags that would have alerted us to the danger of an impending heart attack only appeared in hindsight. I suppose that's always the way, hindsight 2020. We're doing some Monday morning quarterbacking. But I had quite an experience, was hospitalized multiple times, underwent several cardiac procedures, underwent 2 rounds of cardiac rehab. And so now, in the 2 years since, that has changed my professional focus in the direction of my practice. And now as we begin to deconstruct the story, that takes us back about 6 or 7 years earlier. For a completely unrelated reason, unrelated to my liver, I underwent a CT scan of the abdomen. And fatty liver was one of the incidental findings. Well, upon follow-up for the other issue, the fatty liver was brought up only because I brought it up with the physician who ordered the scan. And in our discussion, well, Kevin, this is a common condition. Lots of people have it. Watch your fat intake and try to reduce your weight. Take some vitamin E. But there was no other specific guidance provided to me. And I'm an MD, and I was talking to a colleague who I know and trust in his area of expertise. It was explained as though it's a common finding. We see it frequently. Just pay attention to it. If it gets worse, we'll make a referral. Well, I had to learn. I had to educate myself on this. But in the meantime, there were a number of other stresses in life. That's a broader story, dealing more with some of the roots of what influences our health and well-being. My own diet and nutrition, my own stress level, the presence of toxic and stressful relationships and employment situation, nutrient deficiencies, irregular sleep patterns, all of those things were present. As I progressed through those years prior to a heart attack, I actually experienced an episode of a DVT. We never could figure out where that was coming from.
Let me interrupt with a couple of definitions. We'll get to DVT in a second, but a minute ago you said you had an MI.
Yes.
For those who don't know, that stands for myocardial infarction, and that stands for heart attack. Explain for the non-physicians in the group what we mean by DVT.
So I experienced a blood clot in my leg. Now that was after you think of things that may provoke a blood clot in the leg. I hadn't done any long-distance travel. I hadn't undergone any major medical procedures. I hadn't been hospitalized.
You weren't a smoker, were you?
I'm a lifelong non-smoker. So at the time, my BMI was somewhere between 25 and 30, so I qualified as overweight. But on a day when I was out hiking, I had a hiking boot tied on perhaps a little too snug around my calf. And after that, it lit up an episode of inflammation in my leg that eventually resulted in a blood clot. Now, resolved, this is another one of the clues as we look back. There was something really wrong. There was something driving massive inflammation in my system. Until finally that day when I experienced chest pain. And I had already undergone a stress test. I'd passed the stress test. It's not that it was a bad test, it was just the wrong test for my situation. So I'd already been through a battery of tests. I had finally turned the corner, was making changes, healthy lifestyle changes, was dropping weight, and according to the good old Framingham risk calculator, I got a pat on the back from my primary physician, and he said, "Kevin, whatever you're doing must be working. Keep up the good work. The Framingham risk calculator says you've got less than a 3% risk over 10 years. 4 months later, I was lying in a hospital bed with a collection of stents. I had just survived a widowmaker heart attack event.
So that sounds like you're not such a big fan of Framingham at this point.
We all know there are better ways of doing this. This audience in particular is well aware.
Could I just put that in perspective? I mentioned that book that we're working on and the headaches associated with it, but that book is about this issue. The typical thing when you go in to see your doc is he'll do a Framingham. That's a risk estimator based mostly on information coming out of the Framingham research program in Framingham, Massachusetts, about an hour outside of Boston. There are problems with it. One of the biggest problems is that for most people, it doubles your risk of having a heart attack inappropriately. And the question is, can you fix that? No, not really, because the previous ones are even worse. They're based on epidemiological studies. And as Kevin has just pointed out, it can go the other way as well. And so then the next thing that happens is your doc will say, well, why don't we get a stress test? Stress tests, about a third to a quarter of them are false positive or false negative. False negative is a problem. You had a false negative Framingham. False positives on stress tests end up taking most people into the cath lab. Once you get into the cath lab, most cardiologists will go ahead and get you to sign off on doing the stent before they even put you under. So that's that just evil triangle: stress test, cath lab, and stent. The reality is, what you need to know is your metabolic risk. You need to know whether you have plaque. It's a totally different story. So thanks for letting me put that plug in for a different orientation on medicine. Back with your story.
Well, after that event, as I recall lying in a hospital bed, I came across a series of videos from a Dr. Brewer in Lexington, who at that time was still holding pieces of paper up against the camera to illustrate the point of his teaching. And I thought to myself, I need to meet this man. So we connected a few months later, and it was only at that point that we finally unraveled the mystery of what had been occurring, and that was insulin resistance. So it was a core component that helped explain a lot of these smoking guns that we were finding in my medical history. And it was only when we began to tackle that issue head on, understand not only the metabolic markers that were out of range, but what do those markers mean? What do they indicate? Secondly, how hot is the fire inside? What can we learn about numbers that measure or assess vascular inflammation? And then the third component is, how do we appropriately assess the presence of plaque? What is the plaque burden in the body? Now, in my case, I already knew that I had it, but bear in mind that even my interventional cardiologist was very surprised that someone at my age and with my medical profile had such extensive coronary disease. His job is to be an expert plumber, so he got me out of trouble when I needed it. So thankfully, there was a high-level intervention, and actually it required several of those procedures. But on the back end of it, then prescribing high-dose atorvastatin, there wasn't much more, that and a daily aspirin wasn't much more to offer. So that was a completely different discipline and lifestyle change.
Kevin, did you have a stent as a treatment directly for your heart attack?
I did, yes. So that is what stopped the event. I continued to experience some unstable angina, and I had to go back in.
Just another point for orientation for folks. You hear me time and time again talk about how a stent won't prevent heart attacks.
Correct.
Stents are very much indicated and life-saving when you're able to give a stent as a treatment for an active heart attack. The major issue is 90% of stents were not done for treatment of a heart attack. 90% of stents are done to prevent a heart attack, and they just don't work for that purpose. You're bringing up some great teaching points, Kevin. Thank you.
You are welcome. My life and my career at this point pivoted into redeeming this whole experience for something far more beneficial. A huge number of people experience a first-time cardiac event without really any prior warning, or other issues have escaped. They've passed beneath the radar until ultimately someone is in deep trouble, or they don't survive, or they survive the event with permanent disability afterward. Being aware of that now, a lot of cases that I have seen through my career suddenly begin to make sense, where I had some gut-level suspicion there were greater issues at stake, and merely throwing a statin or medications after a particular problem, all we were trying to do was adjust a particular lab number, not really understanding the importance of that lab number. What does that mean? What's going on inside someone? What kind of internal chaos is present? And how can we correct that chaos and quiet that fire? And that is ultimately what reduces someone's risk. We're not really looking to take somebody's numbers necessarily and correct them to perfect levels, but we are looking for progress. We're looking for improvement. And I believe that is where significant risk reduction and improved quality of life occurs.
So Kevin, you've added some new capacities, some new services to what you do. A little bit about that?
Yeah, so my wife and I have we're a husband and wife team. In her career in medical management and administrative capacity, she's had her own health challenges. We have a partnership that we call Second Chance Health PLLC. There's our effort to redeem our own experiences for the benefit of others at large. Everybody deserves a second chance. We're thankful for our own second chances and want to see that spill over to other people. So we're taking this combination, what we've known out of the world of conventional healthcare. We don't want to completely disparage pills and procedures where necessary. There's an appropriate place for them, but we want to do more than just merely perpetuate someone's diagnosis or their pathology. We want to get over to the other side of this thing. Where can we really leverage health? And that's getting into the root issues of how diet and nutrition, how exercise or sleep pathology, poor oral health, exposure to toxins, toxic relationships or environment, how nutritional deficiencies affect someone's health. We don't have a way to prescribe that. Those things don't come in a pill bottle, and there certainly isn't a procedure for that. So that really requires a partnership with healthcare providers who want to see you regain your resilience, your vitality. We're looking to coach up those opportunities that restore someone's health, their capacity for healing, their energy level, and that requires a great deal of accountability. We're not just merely in the role as healthcare providers brokering prescriptions to everyone. This is a collaborative situation. People need to be engaged in their own health. This is a healthcare stewardship proposition. We're here to help guide and coach, to collaborate, and then there is a level of accountability that's expected as well. Where can we use labs then, not just to monitor how well a particular intervention is coming along, but how well are you managing your health? Are you aware of these numbers, what they mean, how they serve as guideposts, and opportunities then for further improvement? It's a story. We'd like to see people avoid events like I experienced. On the other hand, most of us get to a point in our lives and our careers where we're stuck. We really don't realize the danger we're in. There's a great deal of self-denial, and we're on a hamster wheel. We're stuck. And sometimes it takes some real honesty from a healthcare provider to come alongside you and say, with a healthy dose of some truth, and identify opportunities for change.
Continue to get great feedback regarding the webinars, and here's why. On the internet, when you hear a webinar, you expect for somebody to try to sell you something. We're not doing that. We're trying to tell you something. People are coming in with their labs from Quest, inflammation panel, OGTT, insulin survey response, and then they're finding out, do I have inflammation? Do I have insulin resistance? And where does that fit in terms of other folks? We're getting ready to start one for CINT as well. So again, people are really excited about finding out their own status. Looking forward to seeing you there. Thanks.